Hi, loves. Thank you for joining me on this special in-studio episode. We are now more than halfway to 100 episodes of AW Confidential podcasts. Many stories have been shared on this platform. The story I will share with you today is a personal one. According to the American Thyroid Association, it's estimated that 20 million people in the US have thyroid disease. As many as 60% don't even know they have it. Thyroid disease is a dysfunction of the butterfly-shaped gland at the base of the neck. Hypothyroidism is when thyroid gland doesn't produce enough thyroid hormone. Hyperthyroidism is the overproduction of the hormone. In June of 2022, I was diagnosed with Graves' disease, an autoimmune disorder that leads to an overactive thyroid gland. Hyperthyroidism is what I have, and I had not been feeling well for a very long time. I lost a drastic amount of weight. I went down to 85 pounds. I had hand tremors. I had night sweats, hair loss. I was in a really dark place in depression, and I had a high level of anxiety. My heart was beating out of my chest. I had heart palpitations that sometimes exceeded 172 beats per minute. I had never felt worse in my life, but I realized that I'm not alone. And today, I am on medication. I am hopefully on my way to remission, and I feel a hell of a lot better. Mabel Martinez is a seasoned journalist turned social media maven. She has worked at top-tier publications like People Magazine, Glamour Magazine, Siempre Mujer, El Diario La Prensa, and so many others. Her career pivoted when she took on the role of social media and communication coordinator for Dress for Success, which is an amazing cause. She followed up with being junior copywriter at Bare Minerals, and then she carved a path to L'Oreal, working at Maybelline, where she managed the social strategy and orchestrated the viral success of the Superstay Ink Liquid Lipstick Thrill Seeker. And I do remember that campaign. That was an awesome campaign. Thanks. Currently, she is the senior social media and influencer manager at one of my favorite brands, Lancome. Mabel, thank you so much for being here.
Thank you so much for having me.
You're so amazing. You've had so many wins. Thank you for being here.
Of course, I'm happy to be here.
Now, as I mentioned earlier, I was diagnosed with Graves. And I read that hypothyroidism, which is the underproduction of the hormone, is 7.5 more common than hyperthyroidism, which is what I have. So literally, we have the opposite of each other. Now, you've had your own experience with hypothyroidism, and you were diagnosed with Hashimotos?
Yes.
So I wanted to have you here today to share your story and tell us about your journey, as much or as little as you'd like to, and just give us sort of a bird's eye view into what happened to you and how you found out.
Yeah, so for me, it started out in December 2022. I went to the doctor, same year as you, crazy. I went to the doctor for my yearly physical, and my doctor noticed that my neck was like enlarged, and she's like, we should check that out. Let's get you an ultrasound. So I was like, okay, fine, no problem. Went to get the ultrasound, and then the nurse is like, taking pictures of my neck. And then she calls in a doctor to look at it. She's like, this doesn't look okay. But she didn't say it, but you just kind of sense that vibe. And I'm like, okay, something's up. And then the doctor leaves, and then I talk to the nurse, and I'm like, hey, can you just tell me what it is? Because no one is telling me anything. My doctor, she couldn't really say anything either. So she's like, I can't say anything because I'm not the doctor. And I was like, okay, just tell me, is it big? And she's like, it's big. And I was like, okay, great. So I left the room. My mom was with me, and I didn't tell her anything because I was like, she's gonna freak out.
Lose it.
But then I got to the car, and then I was like, so this is what she told me. I don't want you to freak out, but this is what it is. And she started crying. You know, like the Dominican moms, she starts calling everybody. She called like the whole family in DR, everywhere. And I'm just like, I don't need this right now. But like that whole day was like a blur because I just couldn't believe like this was happening, and I didn't understand like what it was. So then fast forward to like a couple weeks later, my doctor's like, hey, we need to get you an ultrasound guided biopsy. And I was like, what is that? She was like, don't worry, it's just a little needle. They're gonna just pick you and collect the cells from whatever you have in your thyroid. So I'm like, okay. So I go get that done, and it's literally like they put a fine needle and they use an ultrasound to like collect the cells of the nodule that's attached to your thyroid. So what I had was kind of like a tumor attached to my thyroid, and they collected those cells to test if it was like, you know, normal cells or like cancer cells. So they tested for that. Then the report came back, which took forever. I want to say like 2 weeks. I was like waiting for these results.
I can imagine.
And it came back, and I had Betsita 3, which is like the cells are not normal, they don't look normal, and they don't understand why. And then the risk of it being cancerous was like a 5 to like 15% chance. So that was like, for me, I was just like literally nonstop crying every single day. My family was too. And then my doctor referred me to a specialist, so a ENT doctor, ear, nose, and throat doctor. And he walked me through everything. He was like, so we looked at the size of it, and it's really large. It's a really large tumor attached to your thyroid. And he's like, initially, you know, some people, they don't need to take it out, and they just like monitor it for changes. But in your condition, you have to get it taken out because it could develop to cancer, and they don't know what it is.
Did you have any other symptoms?
No, which is crazy. I didn't feel no pain. I had no like neck pain, no nothing. I didn't feel any different.
Wow.
So it was really like just wild that this was happening. And when I spoke to my doctor about it, I'm like, what is this? Like, what's going on? And they did like a bunch of tests, blood work, genetic testing. I did so many.
And when, sorry to cut you off, but when they did the thyroid profile, your levels were...
They were all in the red. And then that's what it came out, that I had Hashimotos. And Hashimotos, that's a different like thyroid disorder where it's like your immune system is attacking your thyroid, which causes your thyroid then to get inflamed and your neck to swell.
Disorder.
It's an autoimmune, so you don't feel anything.
Which is the opposite.
Yeah. So that was
you
wild.
wouldn't have known.
I would have known.
So
at all.
what got you to the doctor? Was it a physical?
It was just a regular physical.
Checkup?
It was I do the checkup every single year at the end of the year, and thank God my doctor noticed, because I wouldn't have noticed. But then what's also crazy was a couple months before, I was looking at myself in the mirror, and I was like, my neck looks kind of big. I really need to like stop eating as much, because I was like, oh, I'm just getting fat.
Right.
So,
right. Exactly.
Yeah, and then next thing you know, 2 months later, that was the whole issue.
So you had this really scary moment in your life, and health scares, I mean, I know from experience, they're life-changing. They just change the way you look at life, what you're gonna do next. What lifestyle changes have you implemented since your diagnosis, just to help improve, you know, your physical and mental well-being? Because I know it took a huge toll on me. I mean, I eat clean, I don't exercise as much as I should, but you know, I don't smoke, I love my wine. I don't do it excessively, but I love my wine. But I've implemented little things, like there's certain things that I don't eat anymore. I changed my salt to I think it's called it's no sodium salt. So I've done little things to kind of help my body, because I think that you have to help yourself as well. So what lifestyle changes have you had?
I completely changed my diet as much as I could, but I did a lot of research on like how to keep like your hormones like balanced, and I saw that I needed to eat like foods that were anti-inflammatory. So that meant getting rid of wheat, gluten, soy, like a whole bunch of things. And don't get me wrong, I still eat my pasta, my fries, my burger, pizza. But I do it in like moderation too. So like I try to like focus on like whole grain and like foods with high fiber and a lot of like antioxidant fruits like blueberries, like a lot of fruits, salmon, like healthy fats, avocado. So I still do all of that. And then I also read somewhere that like selenium is a key like vitamin that you should have in your system. And I read that Brazil nuts have that. So I eat one every single day. And if I have a smoothie, I like drop one in there. And then I also started doing turmeric powder in my smoothies, in my eggs, because that's anti-inflammatory too. So I really try to like, you know, change up my diet too much, but I'm not like completely vegan.
You have
I
to
don't
live, right?
I have to live. I love like my sweets and all that stuff. I love my sugar, but I just try to be like more moderate. And also I'm Dominican, so like that too is
Certain
hard.
things we can't stay away from.
I can't. So yeah.
So life happens, and it happens so fast, and it happens at the same time. And I feel as women, we're so busy and so preoccupied taking care of everyone else that we end up putting ourselves last on the priority list. Thyroid disorders affect women 10 times more than men. I'm sure you know that. So, in your opinion, can you share with us maybe a couple of things that women can do? You can't guarantee that you're not going to get it at the end of the day. There is no guarantee for any of this, but maybe some tips that can help just overall, sort of. I hate to use the word deter, but just kind of help your body. Do you have some tips?
For me, I would say my number one tip is try to like reduce stress. Like,
thank you.
Stress can really kill you, and
honestly, I think that's what triggered it for me.
Same for me. And I don't want to say stress can kill you. I just think that it will impact like your physical and your mental well-being, and then that will just like spiral out of control. So it's like I think that's also what happened to me, because I was just like nonstop, like going from one job and then like right back into the other and like not giving my body any breaks. But I think really managing your stress is key, whether it's like, working on like your like stress levels, trying to like have more like a workout session. I think that's also good. One thing that's helped for me too is like working out more, just to like release all those toxins and like produce that like serotonin. And
how many times a week do you work out?
I did twice a week. I
that's
stopped.
More than I do.
I stopped, but I'm gonna get back into it now in January. But I feel like that also helps. And I think one thing that also helped me, especially with like managing stress, is journaling. And I got into it in November. I went to this event by Jalissa Calderon, and she came out with a Dream and Manifest journal. And then since then, I've just been like journaling, writing like what I'm grateful for, things that make me happy, my manifestations, and like that has really helped me to like release that stress and like having meditation, I started meditating too. Deep breath work, like it really does help.
It does, and it just changes your state of mind in general. And I'm not saying it solves all the problems, but it does sort of help center you. And literally, I do maybe 10 minutes a day. Although the more I do it, the more I need. So at night, I do more like 20 minutes because I don't feel that 10 is enough. But there are different ways to cope with our stress, and I think it's huge. I mean, managing your stress can improve every aspect of your life, emotionally, spiritually, physically. So one of the things that I feel I have encountered throughout this experience is, I think, all the lessons that I've learned. One has to do with managing my stress, but I think the other one has been putting myself first more.
That's important.
I don't do that enough, and I think a lot of us are in the same boat. What has been one lesson, and I know it's hard to choose one, that you've learned throughout this experience? Because like I said, initially, it's life-changing.
Yeah, I think one lesson for me is, like, it's okay not to be booked and busy all the time. It's not a
Say
flex.
it for the people in the back.
It's not a flex. Like, it's really not. Like, it's fine to say no to things. No is a full sentence, and that's it, period. And it's like, I was at a time in my life where I was like busy all day, every day. And I thought like that was great, successful, like amazing. But it's like, no, it's not. Like, you need to give your body rest. And at that point, it was like, everything that happened to me, that was a wake-up call. Like, my body was literally screaming for help and I wasn't listening. And then that's what made everything like happen. So I was like, since then, I say no to things. I'm very intentional with like, you know, what I do, what I say yes to, who I surround myself with, because I just don't want to be back in that place anymore. And I really want to like live my life and like be healthy.
It's scary.
Yeah. And then I know you said one, but I have one more.
Okay.
But I also feel like since this is like thyroid and it's like your like throat, a lot of back in the day, I was just like, I wasn't as like vocal as I should have been. And I feel like that also maybe could have been why that tumor happened on my neck. Like, I was just storing all that I should have like spoken out or like said things. And now more, I express myself fully, whether it's at the workplace, whether it's with my family and my friends. So I just don't want to store any of that in my body. I'm just going to like express it more. So those were.
Thank you for sharing that.
Thanks.
It's important. You found your voice again.
Yeah, exactly. Yeah. Exactly. That's perfect.
So like I said, I'm feeling so much better. I'm more productive, but I do give myself rest. I'm on medication. The goal is to get me to remission. Hasn't happened, but I'm okay with that. I accept that I might be on medication the rest of my life, and I'm okay with it because I'm in a healthier place. How are you feeling?
I feel great. In March, it's gonna be a year of my surgery. So the scar is like fading. I have a turtleneck now, so you won't see it. But it's I feel better. I don't feel as like tired as I was before. So far my like results have been all good. So I'm like, I hope it stays that way. So I feel like my diet and everything has been working. And I have been better with like managing my stress. And I also recently got a therapist, so I'm starting therapy very soon.
Yes! So. Girl, I've had a therapist, I don't know, maybe past 10 years, and they work wonders. I think everyone should have therapy.
I think it's so important, especially when you're managing stress.
Absolutely.
Like, just having someone to talk to just so you can control like your nervous system, anxiety. Like, I think it's important. So I'm like,
think about it. They are bound by their code of ethics. They can't, anything you tell them, they can't talk about it.
There you
go. Could be better than that.
Exactly. Yeah, so I do feel great though, so I'm happy.
Good. So one of the things that I love to do at the end of interviews is share a message of encouragement, whether it's a mantra, a quote, or a piece of advice with our community. Can you offer some words of support for anyone dealing with their own health issues or health scare? And it could be anything that you maybe have used and you feel like, you know, I need to share this.
So in my like little workstation at home, I have like Post-it notes of like affirmations and mantras. I just like look at as like I'm working. So there was one that stuck out to me today and I like wrote it down. So I'm just gonna like read it real quick. So it says, I let go of any negative thoughts and embrace positivity and healing. So that's my mantra. Because I feel like as long as you be positive, think positively, don't let the small things sweat. Like, don't sweat the small things.
We're not saying it's easy. It's hard,
not,
right?
It's not easy. I feel like that will just completely change your mindset. Always just like be positive about everything.
I think that is one of the most important things that we can do for ourselves. And it's a great way to close out our episode. Thank you so much for sharing your story. You know how much I love you. We just met like, I don't know, less than a year ago. But this is my girl. Please share with our listeners how they can find you and, you know, learn more about what's next for Mabel.
Yeah, so you can find me on all social platforms at Miss Mabel Martinez. And my website is mabelmartinez.com. Thank you.
Thank you for just being here. And thank you all for joining us on this special episode of AW Confidential Podcast. And tune in each week for new episodes. We appreciate you. See you soon.
Bye.